the problem that we've got is that we are now entering, I think, the 10th week of industrial action, and we have been coping reasonably well with each one of the kind of days of this industrial action through a combination of planning by health leaders and agreement by the trade unions to maintain life and limb cover, and also the public using the health service less on those strike days. And the danger is that because we cope with these individual days, we're not realizing the damage that is being caused below the surface. So with the most intensive week of strike action the health service has seen coming up next week, we spoke to our leaders and asked them the impacts they're concerned about. And number one is that the recovery that we're starting to see in the health service is at risk. So we have seen real progress in the last few weeks, shorter ambulance delays, making inroads into those waiting lists. We're still confident that by the spring, no one will be waiting more than 18 months for an operation. But our leaders are saying that recovery in terms of operations, getting urgent and emergency care back on track, that is jeopardized if we continue to see these strikes unfold. So that's the first issue, is that the recovery is under threat. But there are other challenges as well. We're concerned about the public holding back, because while we're grateful for any support from the public, as NHS England said yesterday, if the public needs to come to the NHS if you have got a problem, because otherwise those issues get stored up in the community. So what we can't have is just this protracted kind of war of attrition. It is having an effect, and that effect will worsen as the strikes worsen, which is why it is, once again, we're calling on the government to find a way to reopen negotiations and on the trade unions to enter negotiation and try to stop this industrial action continuing.
I spoke to the BMA this morning, and they told me they thought it was likely that junior doctors would also vote to walk out. They're being balloted at the moment. What added pressure do you think that would put on the health service if junior doctors walked out too?
No, well, that would be another huge blow, another huge challenge for the health service to cope with. We're already seeing on Monday, for the first time, combined strikes, ambulance strikes, nurses strikes on the same day. So, this is an escalating and deteriorating situation. Junior doctors would really certainly intensify it. But even without the junior doctors, as I say, there is an impact. We've seen nearly 11,000 operations cancelled, nearly 90,000 appointments cancelled, and that's before next week adds to this. And another thing I'd want to say is that there's a lot of talk, quite rightly, about the NHS modernising, reforming. We saw the other day an announcement of a major rollout of hospital at home, using technology to enable people to get care in their own homes. It's very difficult for managers to innovate and reform when they're spending their time rewriting rotas, trying to think about how to cope with these strike days.
In Wales, Welsh NHS staff have suspended strike action following an improved offer from ministers there. Are you encouraged at all by that?
I think in the sense that it is clear that, in a sense, whatever side you're on in this dispute, it is only if government is willing to reopen negotiation about pay this year that we're going to see any movement. The trade unions have made clear that they won't enter negotiation unless that's on the table. So I think it does depend on the government being willing to take that first step. That's what we're calling for again. Obviously, it requires the trade unions to be pragmatic and realistic as well. But until the government takes that first step of being willing to reopen negotiation on this year's pay settlement, it's difficult to see any progress. And so these strike days continue with this impact, which is often hard to see, but is growing under the surface.
And as we say, those strikes across the NHS set to begin on Monday. The RCN, the Nurses Union, has said in the wake of the progress that appears to be made in Wales, they've urged the government to reopen talks. As I understand it, Downing Street has said that there's no talks planned for this weekend. So what is your message to them?
Well, all we can do, and what we're saying today is the result of having spoken to our leaders in detail last week, is to point out the consequences of that. And, I understand the pressures on the government in terms of public spending, industrial action taking place across the public sector. But ministers have also emphasised the incredible importance of getting the NHS back on its feet, of recovering from the winter crisis that we were in, of making inroads into those waiting lists. And the government's going to have to make choices, because unless it's willing to find a way of reopening negotiation, then that recovery, it's just seeing the first signs of it, and it's something to be really pleased about, given where we were a few weeks ago, but that recovery will be at risk.